Hi again. I'm Dan Ramey from the Hometown Motors Incorporated studios. A Litter Media special report moving forward in the pandemic. We wanted to gauge some area leaders on their thoughts regarding staying safe and moving forward as Ohio continues to transition from staying at home. Now, we'll in no way be normal again, but we are heading into that direction. Coming up on our program, we'll hear from Dr. Kirk Tucker. He is Adena Health System's Chief Clinical Officer, as well as Captain Ron Meyers of the Chillicothe Police Department. In our next segment, a visit with Chillicothe Mayor Luke Feeney, Ross County Commissioner Doug Corcoran, and Ross County Sheriff George Lavender, along with Ross County Health District Administrator Ben Avery. That's coming up next. Husqvarna handhelds, chainsaws, trimmers, leaf blowers, hedge trimmers, and more. Buy it here, get it serviced here. Hometown Motors Incorporated, 818 Eastern Avenue, Chillicothe. A special grouping of individuals with us. We have the Sheriff of Ross County, George Lavender. Thank you for joining us.
Good morning, Dan.
Also, Mayor Luke Feeney from Chillicothe. Thank you.
Morning, Dan. Good to see you.
Commissioner Doug Corcoran representing the Ross County Commissioners. Good morning, sir.
Good morning, Dan.
And also the Administrator for the Ross County Health District, Ben Avery. Many of you, thank you for joining us here today. The newly wedded Ben Avery, by the way. So congratulations there. We wanted to take a moment to really find out what you had to say in regards to where we stand as a community. And if you don't mind, let's start with Mayor Luke. You have held many sessions with others much like this to really discuss where we are and how we might be able to move forward. I thought we'd let you lead us off with some opening remarks this morning.
Well, thanks, Dan, and thanks for pulling us together. I think, as the other three on this meeting know, communication has been maybe the most essential thing during this time. I can tell you that the relationship between the health district and the commissioners and the sheriff's department has really made for our ability to navigate this situation so much, I don't want to say easier, but it's made it, the cooperation, the relationships that we had coming into it have really enabled us as a group of community leaders to serve the community better. And so those conversations that I've been having on Facebook have just been a way for me to help, Ben and others who have information to share with the community. It's just a way for us to get that information out. Radio's away, Facebook's away, newspapers away. And so we think that the better the public is informed, the safer we'll all be for the long term. So I appreciate everybody that's come on those, and I really appreciate those on this call and others in the community have just really worked so well together. It's really been a team effort like nothing I've ever seen before.
I have been in this community now for, going on 40 years now. And there's always been, while the county and city has somewhat shared a lot of area, it always seems like it has been us and them in many cases. But this has really brought us together. Would you be willing to speak on that, Doug?
Yeah, Dan. I think we've always prided ourselves in this community as being, at least the elected officials all work together for the best for our community. And I think we've always worked well with the city. There's been maybe a few times where there's been some territorial issues with maybe utilities and things like that, but that really wasn't city county. That was the city and the private water company. But no, I think it's great. The health department, the sheriff, police, all of us, I think have all joined together throughout this pandemic to work side by side. But I think this pandemic has just brought that to light. That shows how all the leaders of the community care about what's best for the community and want to work together
to make that happen. Absolutely. Sheriff, let me have you comment now. You're a native to this area. How have you, this is something we've never experienced before. And what's the experience been like for you and some of the changes you've had to make with the Sheriff's Department?
It has. It's been hard to work through, but when you look at the cooperation among all the people that's been involved with this, not only the people here, but across the board, as far as the politicians, the community leaders and the people stepping forward. One thing I worried about at the start of this, when we started hearing that, a pandemic was taking place, is getting the population down in the jail, because we all know that, our numbers were very high in the jail. We knew that if it got in here, it would be a mess as far as being able to medically separate those people and take care of their needs at that time. So, the judges, the common police court judges, municipal court judges, the prosecutor's office, Jeff Marks, we all sat down and did a review of everybody in the jail at that time. We lessened our population tremendously, so that we would have a buffer that if we had to make a street arrest, we can put them in quarantine for 14 days before we ever move them in general population, so we can assess if those people had the COVID-19 or had been around with somebody with the COVID-19, so we can keep that separated and keep it out of our jail. We all see in the county jails that has a large population, especially the state prisons, this stuff's running rampant in there, and we have to continue these efforts going forward. I think that's one thing that's going to make it or break it going forward as far as the jail population. If we just all of a sudden start, fulfilling all these street arrests and people we've been putting warrants on, if we just, stack up this jail again, we're going to experience those same kind of problems. And, those people are dealing with them in different ways, and not everything's successful because you got an overpopulation in those areas. So going forward, we've done a lot of house cleaning. We had a professional service come in and clean the jail. We have a guy, just his daily duties with the trustees is going around sanitizing everything all day long throughout the day, and just to make sure this place is staying clean and that we are getting, done what we need to do. And I got to put a hats off to the, Chief Washburn, Chief of Police. They've kept their numbers down from coming in the jail along with the State Patrol. It's just been amazing how every agency's come together to help this happen. We still had a couple people outside of the jail that we was housing in Miami County. They did not want to send them back because they wouldn't take any more from us. If we did, the commissioners, was very understanding when it came to that we need to keep them people off site. It's allowed us to keep our numbers down so we can have both a female and a male range that we can put them in coming off street. And it's just hats off to everybody.
It has certainly changed up how we war room anymore. I know we always have these types of discussions and prepare for whatever, but you never know until it hits the fan, and it certainly did. And that brings us to Ben Avery. You have been very much involved in this almost from the get-go as far as we're concerned, because you have been instrumental. Much comes through your office and getting us prepared. How do you feel things have gone so far?
I think from the outset, we had really good leadership at the state level. So the governor and the Dr. Acton, the head of the Ohio Department of Health, really set the tone. So that made it easy for all of us local health departments, by and large, to get on the same page and be communicating information that was in line with the state level. So I think that helped tremendously. Ohio, it really slowed down their operations early. A lot of our first cases came in when we were already in shutdown. So, I think we got ahead of it, and that's really, shown some benefits as this thing has started to unfurl.
And you have been very instrumental in guiding many of these departments, and I applaud the efforts the Rawls County Health District has done in helping us through this all. I would imagine you're happy with the response as well.
Oh yeah, the cooperation has been amazing. There's nothing like difficult times to bring a community together, and I'm just amazed at how well we're working together. There's certainly been challenges that have come up, but those are addressed, from multiple different sectors, and they're addressed quickly. So that's just been amazing. In terms of the health district's performance, I am very pleased with, how we have responded. We have such a good team here. There's a large number of leaders that have various expertise, and they're out there on a daily basis, trying to do the best that they can to minimize the impact of this. So I am proud of our team.
And I'll throw in a personal note. It seems like a couple of years ago, we were all scratching our heads, many people saying, what do we need a health department for? Well, it is times like this. And I think you have all worked expertly through here to show why we should support a levy such as what we did here recently.
Thank you, Dan.
Guys, I want to take a moment, if you don't mind, now to address some of the areas of how things have changed for you and how you run your sectors of government. Mayor Feeney, we'll start with you because, it's gone down to the transit system is back up and running, not at a 100% capacity now, but passengers are wearing masks. It's a requirement and that sort of thing. But you've got a lot of people to concern yourself with, not only with the city, but more importantly, you've got, 200 some employees here locally that you think about as well.
It's been an interesting challenge. I think that because we have a variety of departments, the police department needs one plan, the fire department needs another plan, the wastewater treatment plant needs another plan. And so, one of the best, again, just I can't emphasize enough the cooperation and communication, questions about, how should we set up a physical building? The health district has been so responsive with guidance. Reaching out to county officials. How are you guys doing this? This is what we're doing. We're all to some extent flying blind. Literally nobody has had this experience before. And so we're taking guidance and best practices from basically anywhere we can get them. That's been borrowed from private sector policies. Some of it's been borrowed from other governments. Some of them are just unique situations that we're trying to work through. Just little things like some parking spots downtown where you can park for 10-minute carry-out food. Just, things on the fly. We're trying to, add to the convenience and safety of life at the same time. And I think you've made a good point. Part of it is keeping the public healthy and safe and keeping essential services moving like trash and police and fire. We need to continue to have clean water. But the other part, like you mentioned, is we have over 200 employees that we want to make sure are safe. And so it's really been a balancing act, but I'll give all the credit to the employees of the different departments for truly stepping up. There's been very, very little, frustration. There's been a true willingness and, expression of wanting to help from the entire city staff. And so I want to thank them for that. I think that they stepped up in this time to continue to deliver services, and I really appreciate what they've done.
And Doug, if you could talk about the county, certainly the commissioners, and for people that don't really know what commissioners do, you have a presiding position that you try to make sure that the county is taken care of in that respect as well.
Yeah, Dan, we do. We've tried to work with all the office holders because everybody has different services they provide. Some have a lot more foot traffic in their offices than we do, and so we've tried to help give them the items they need for their employees to be safe. Of course, right now our buildings are still closed to the public except by appointment, but we're all working together, especially with the EMA and the health department, to put together protocols to open back up, to get the PPE in place, to keep both the employees and the public safe. And I think as we do start to open up, we just want to encourage everyone to practice the safe distancing guidelines and just think about others when you go out. If you have to go out, think about keeping yourself safe and others.
And Sheriff Lavender, law enforcement, it is not always easy to keep a 6-foot distance between you, especially when you're trying to apprehend someone who's breaking the law. And that puts your people into a potential risky circumstance. How's it changed for law enforcement in dealing with one-on-one capabilities?
One thing we started doing immediately is all employees have temperature checked when they come in to keep that out of the workplace. But as far as that, it's business as usual. I mean, we have to take calls. When I took this office, I said I would never take a call over the phone. It's person to person, but we have changed that. We have written some policies, rewritten other policies, but we will take calls over the phone now for just people reporting purposes. We've always had the internet reporting at www.rawsheriff.com to report an incident or an accident, but we keep one person on station now that the minor calls can be taken over the phone. We still respond to residents for calls for service. We try to call them out to have them come out. We tell them when they call, we want them to meet the officer outside. That way we're safe in our environments. We can keep that social distancing space between us. They're wearing PPE on calls, and we're trying to do those things that limit our exposure with that. That being said, though, there's still domestics that we have to go inside a house on or have hands on. Our call volume is, up. We're having more domestic calls because people's home together. And sometimes I guess people can get on people's nerves, like my wife tells me I do hers. But, really, and we have to go in and do burglaries, those kind of calls that requires the processing of a scene. So we continue to do the things we have to do. We had to change some things as far as our building about the CCW or the concealed carry weapons, the concealed handgun license. We had to move that upstairs so that people wasn't coming into the major part of where the employees were. We moved that up. We had a company come in and put that all behind glass so that person's protected. It seems to be working well, and that's probably something we're going to continue in the future, because when you look at this is going to be around for a while. We think that we're still going to have issues with this coming into the fall, from what I'm hearing. But the seasonal flu, we all get sick with the seasonal flu. So if we can continue some of these best practices we put into place and keep that out, and even keep our inmates from getting sick, we're going to continue those practices that has helped us to make it safer for us in this environment. Hats off to Jeff Clark, one of our employees here, a corrections officer. All he does is clean, where before we always had him out mowing and helping out the townships. Right now, our emphasis is on keeping our building clean, because we still have a lot of foot traffic in this building.
I'm still concerned about walking into a bank with a mask on. I don't want to be mistaken for, someone doing evil. I know that Doug has to leave us here, so if I could get your response to one question before you need to take off, Doug. Given the public has varying levels of concern about getting back to some sense of normalcy, what are your thoughts about venturing back out and your words on behalf of the commission of getting us back to a bit of normalcy?
Well, I think everybody wants to get back to normal, but we don't know what the new normal is going to be, Dan. I think from our perspective, we're just encouraging everybody to follow the CDC and the health department guidelines. Again, if you don't have to go out, don't go out. If you do have to go out, wear the protective gear. Think about others' safety, not just your own. But yeah, we all want to get back out. We all want to get the economy going again. Our small business owners are hurting. We know we're all going to be hurting with our budgets, but slowly but surely, I think we'll get back to a new normal, and hopefully and get things going good in the right direction again.
Thank you for your participation today, Doug, and our best to the rest of the crew as well.
Thank you very much. Appreciate it, Dan.
And for the rest of us, let me direct towards Ben now. You've heard from the sheriff, you've heard from the mayor, you've heard from the commissioners. And what about this move forward now? The governor, of course, will probably say something as we're recording this on Thursday. He's expected to say something today about restaurants being able to open up for dine-in, and then the haircuts we all need.
I think, one thing that we've got to emphasize is that, like Doug said, there's just so many unknowns out there right now still with this virus. And we're all trying to do the best that we can to protect ourselves, our families, and but at the same time, there's certainly a role for the economy that in the health of a community as well. And I think, that's what the governor is trying to balance at this point. And he's had to make a lot of tough decisions. But in terms of what I would advise people to do, you just need to be mindful of your actions, and how your actions can affect other people. Just because we are starting to open up, it doesn't necessarily mean that you have to go out. The data is showing us that all people are being affected by this illness, but the ones that are, really being impacted seriously are those elderly individuals and those with pre-existing conditions. So we need to wear masks when we're in public. The mask doesn't necessarily protect us, but it protects other people from catching what we might have. We've seen that there are so many people out there that are asymptomatic positive, which means they're positive for the coronavirus, but they're not showing any symptoms. So they don't even know if they have it. And those people, it appears, have the ability to spread the virus. So, we need to keep our distance. We need to behave as if we have the virus and we have the ability to transmit it. So, being mindful and being respectful, and let's take care of those vulnerable populations, of course. Those are the folks that really deserve some special attention.
I know that one of the things we wanted to ask each of you was how confident you feel in our ability to move forward. And I think it really comes down to governing ourselves in that respect, like Ben was alluding to. And I'm telling you, I'm driving in through downtown Chillicothe asking myself, why is it so hard to drive 25 miles an hour while people are passing by me? Why is it people roll through stop signs? Why is it, if we can learn to govern ourselves that way and pay attention to the warning signals, I think we'd be A-okay. What do you think, Mayor?
I think that there's an anxiousness right now. I think I feel it. I know, we've been cooped up in the house, and fortunately it's springtime and it's sunny out. But I really do appreciate or can relate to the folks who are sort of just bursting at the seams to get out. What I'll say is that this community, I believe, has been incredibly patient with this process. I think that the fact that the leadership, the city, county, health district, everybody's singing the same song. The way that, Adena has led and the major employers. And I think that has led to a situation where it has calmed the public some and helped us all to be patient. I understand and relate to the frustrations with orders about wearing masks and that sort of thing, but I keep relating back to, just the thought that Doug mentioned. The mask isn't for me; it's for you. And so, I've got kids, and I go to the city building, and maybe I got a carry out dinner, and I don't know who I've been in contact with, and there's some chance that I'm carrying something, and I'd hate to spread it to somebody else. And I think if we could visually see when it was happening, it might be, an easier thing to comprehend. But just like we're teaching our son to, cover his mouth when he sneezes and coughs, that's for other people, not for him. And so that's what I just encourage. First, thank the public and everybody out there for how patient they've really been. I'm in touch with other mayors across the state. Over in Athens, you can imagine, a whole bunch of college students. There's been a lot of citations issued for people who are just blatantly refusing orders and having parties. And here in Ross County, I think it's been a much different situation because everybody's pulling together. And so, like the sheriff mentioned, there will be a new normal, but we really are relying on the public and thank the public for their efforts so far. And it has been an effort. It really has been work for people to stay healthy and keep us healthy. So I really appreciate what the public's done to really be a partner in the wellness of everybody in the community.
As we put a wrap on this segment, let's go around the helm, so to speak, for some final words. And let's start with Ben here this morning.
Just appreciate the opportunity that you brought us together today to continue to communicate, the messages that we do have out there, and just echoing the mayor's comments and Doug's previously. This has been made a much better situation based on the cooperation that we've had here together. I know that we had one incident where we had to stand up an isolation site within 12 hours, and that's getting contracts signed, getting cleaners lined up, deputizing quarantine guards. It takes multiple different agencies to make that happen, and it literally happened in 6 hours because we're able to work together. So, I feel like, we're taking the right steps, and we just got to be vigilant as we go forward.
Communication and cooperation, very key there. Sheriff, do you have some parting words?
Yes, Dan, I do. First of all, I want to thank you and Litter Media for putting this together, because it's information that we need to take forward to the public. As we start to venture out and reopen, the things we do right now as far as protecting ourselves and others, it can go a long way, because it would be terrible for us to go out and this to really start spiking again, because people's not taking the precautions they need to help others to move forward. The last thing we want to see is business owners have to close because of, their money not coming in and they can't maintain their business. And, this is all in the early stages of opening up, where that could make a great financial impact on those people. And, just by putting on a mask, if you can protect somebody and save their business, we need to look forward to do that and be our own best person in that aspect of carrying that message forward. It's been great to work with the community leaders involved in this. They've all stepped up to the plate, and it just should assure the public that any emergency that we face, nobody foreseen this coming. The economy was booming, sales was up, sales tax was generated, the state as a whole was on the incline, and all of a sudden, boom. It just shows you the great impact that something can have in people's lives, but people come together to make this all work out, be better for the people, but it's a cooperation of the people involved with us to make this happen. And we just want to say hats off to the public. Going forward, continue to do your best and protect everybody by wearing a mask and doing the things to safeguard yourself and others, and let's move this economy forward.
And Mayor, I'm going to echo back on what the last 3 or 4 years that I've heard in my industry from what people have said about Chillicothe and regarding to being proactive with the addiction problem, and the many things that happen here that don't happen elsewhere. And people scratch their head and say, why can't we do it like Chillicothe does it? And hats off to you and all of our local residents for working together to make that happen.
Yeah, I think the mood that I've been in, or I've at least tried to put myself in, is one of appreciation for the people of this community. So I'll wrap by just saying thank you, echoing the sheriff, and thanking the sheriff and all frontline responders, first responders, nurses and doctors. Sometimes we think about them in isolation as they're just nurses, but they have, or that's their job, but they have families, of course, that they go home to and they're worried about. And same with, the sheriff's deputy's got to go knock on that door, and who knows what they're running into. So a big thank you to the frontline responders, and that includes people at grocery stores and ones that maybe 2 or 3 months ago we didn't think of as on the front lines, but they truly are. So I've just tried to be in a place of appreciation lately. And today is actually, of course, the National Day of Prayer. So I want to say thank you for people's prayers for the leaders in this community, and all that's meant for so many, because we really are connected right now. And Dan, I think you're right. I think that this city and this county, we're something special. People are looking to us for how we're getting through this. We really felt positioned like we're ready to take the next step with World Heritage and downtown and everything that was going great. But I think all of that momentum also positioned us to get through this pandemic better and more swiftly than a lot of other communities. And that's just really because of everybody pulling together. So I'll end with a big thank you.
And I echo that. I forgot about it being National Day of Prayer. And normally you guys are all lined up in front of the courthouse and people from clergy have their hands on you, praying for you. But we know that today it's being done from a virtual aspect and from a distance. And if you don't mind, I've got my mask ready and just to say thank you to you guys as well. So thanks again, fellas, for participating. And we know that we'll have contact down the road again. And hopefully it'll be face-to-face in a different setting. Thank you again for your help today. You're watching our Litter Media special report, Moving Forward in the Pandemic. Coming up, a visit with Dr. Kirk Tucker from Adena Health System. Joined now by Dr. Kirk Tucker. He is the Chief Clinical Officer for Adena Health System, and we appreciate you joining us to look at some of these circumstances. I mean, last time you and I talked, it's been probably 5 weeks or so, and we were in the early stages of this pandemic. How do you feel we stand right now? While we want to say it looks like it's under control, but we don't know that for sure.
Yeah, we're certainly in a position today which is much more reassuring than when we started. There was a huge degree of uncertainty as to this idea of a surge. I'm sure everybody's used to hearing that word. And what our fears were that the infection would spread so quickly and affect so many people severely that the health systems around the country and around the state and around our region would be overwhelmed. Not enough ICU beds, not enough ventilators, or physicians and nursing staff to be able to manage all of those sick people. That never really manifested to the degree that we were anticipating and planning for, which I'm certainly thankful of. I would much rather have the cards I've been dealt today than I thought I was going to get 6 weeks ago.
Still, that being said, this is still a very situation that you've had to adapt to. You've had to really get your staff up and running. Everyone has to get in the same mode. And while we've not seen what happened in New York or in Detroit, it's good to know that our people were prepared for chance that happened. And who knows, we may have that second surge.
Yes. I'm very hopeful that anything that would be like a second wave or a second surge won't be anywhere near what the country has seen first pass. And I personally doubt that it would be anything that we would struggle to handle. So I just want to sort of reassure the public. I do not believe that we will see another major event this fall that will come anywhere close to overwhelming health systems. But yes, we prepared very early on for really a true catastrophe, opening up the PACCAR Virtual Hospital, which expanded our capabilities by another 65 beds. We trained over 50 medical staff in the basics of critical care and being able to manage ventilators. People that had done it in the past but maybe hadn't practiced at that level in a while, and certainly dusted off all of our equipment and made a good accounting for those, and had over 50 ventilators prepared to handle whatever would come our way. Certainly, a lot of this was managing PPE and ensuring that we didn't come anywhere close to running out, and I think that the health system did a very good job of keeping out in front of that. So there was a lot of planning for just so that the public can get a sense of the magnitude of what we were being prepared for. On an average day in 2019, the inpatient census at Adena was 150 or 160. We were preparing for upwards of 500 patients being present on campus and cared for at the peak of this. Now, we knew we would have to sustain that maybe for about a week, 10 days, and then it would begin to go down. But that just kind of shows what we were getting ready for. Doubling up rooms, putting beds just about everywhere, spaces that had been meeting areas, turning those into hospital wards, all of PACCAR being flipped to become a real hospital instead of a virtual hospital. So we were preparing for true catastrophe, basically mimicking exactly what they were doing in Columbus at the convention center. The three big health systems there were standing up that convention center for overflow. we were following that lead, standing up our spaces for availability here.
As we transition now and Ohio starts to go back to work, what sort of concerns do you have? I know that if anything, over the last 8 weeks, we've had a lot of education. We've had a lot of change in how we do our habitual everyday stuff. I think that's got to help us down the road here.
Absolutely. I think some basic things will linger far beyond this recent couple of months of events. Things like shaking hands and being in very close quarters with folks. You know, we're talking about that even here now. When can we go back to some semblance of a face-to-face meeting? What would be safe, and what kind of a timeline are we looking at? I think that the vast majority of the public is going to have to get used to the world being a slightly different place for probably the next year. In that, we're going to have to be very conscious about places where generally crowds form, grocery stores, the DMV, banks and whatnot, and those things have to be mitigated for safety's sake. It can be done. I think if you walk in any grocery store today, you can see just exactly how we're able to pull this off. We're trying to mimic the very same thing in healthcare, meaning we understand that we cannot have people filling a waiting room. So we're looking at things like having people wait in their cars in the parking lot, then getting a text that it's time for your visit. Come on in and see the physician or nurse practitioner. So a lot of things will have to change subtly in order to keep us safe through, I would say, the next 12 months of events. Certainly the world hopes for a vaccine. You know, we've worked on a flu vaccine now for nearly 100 years, and, you know, that's partially effective. I think for this particular virus that what we're going to find is that it's probably already swept through a large portion of the population that doesn't even know it, but they've had it. And that a second exposure, let's say this fall, is then much less likely to result in severe illness, such as what we hear about, the overwhelming viral pneumonia and respiratory failure. So those things are reassuring. Having the virus is like being self-vaccinated. And that's kind of what we're looking for this fall and next spring.
I know that history has given us the Spanish flu of 1918 to look back on. How do you think maybe down the road, 2-3 years down the road, will we look back on this?
Well, when you remember back to SARS and MERS, those are both also coronaviruses. The difference with those outbreaks and what we've experienced here was that the countries of origin were able to respond, test, isolate, and eliminate those infections before the firestorm spread began. Clearly, something happened here where this virus began, and local governments, whatnot, did not perform to that level, and this thing got out and spread. I think that that memory for humanity is short-lived. That with each passing of a generation, we forget the important lessons of what history has taught those who came before us. And for now, us, this generation, focus on public health and the importance of public health, funding, prevention, the country being prepared to rapidly be able to ramp up testing should something new present itself. Supplies of PPE being kept on hand by local health systems. So I know that myself and the management team here at Adena is already stockpiling PPE, and our intent is to keep 90 days of PPE, gowns, gloves, masks on hand and in storage at surge levels. So anticipating the next pandemic, let's say it's a flu pandemic in 3 years. When we're met with this again, we plan on having all of the PPE standing prepared and ready so that it's not a mad search around the nation to find it. So there'll be a lot of lessons, I think, like that. The importance of funding county public health agencies so that they have the personnel that when we have these outbreaks, they can go out, track them down, and do tracing and get people quarantined and isolated before it becomes a major global event, which is exactly what happened here.
If anything, we're better prepared, and it's forced us to be better prepared and learn how to do things new, just like telehealth.
And as everybody can see, the cost of being prepared and funding forward is a heck of a lot cheaper than what we're dealing with now and the effects on the economy.
I'm reminded of that commercial, you can pay me now or you can pay me later.
That's right. And one's a lot more expensive.
You bet. Well, thank you for your time today. Anything you would like to say in parting words?
I think just as I echoed early on that, and I've echoed this throughout the health system with our physicians and our nursing staff, is that after 6 or 8 weeks of living through this, even I myself can find myself feeling burned out and becoming complacent. I sometimes just want to say, to heck with this mask, I'm going to the hardware store and everything else, just be darned. I think we're definitely on the tail end of this thing. The country has seen what I believe to be its peak, and now we're on the long downward swing back to normalcy. And it's so very important that for all of us here in our community not to let our guard down now. So keep doing what you're doing. Keep focusing on social distancing, not going to places unnecessarily. Send one person to the grocery store at an hour where it's not jam-packed. Get what you need, wash your hands, wear a mask, and our ability to say goodbye to this whole series of events will come much quicker if we don't all go running back out to public gatherings and sort of reignite another firestorm. That is theoretically possible. So we want everyone to be safe and to just keep up the efforts until we officially declare this thing over.
Our hats are off to all of you, and we appreciate what you folks have done out at Adena, and not just Adena, but other medical services across the country. And please give them a tip of the cap whenever you have a meeting or so for them. Give it from us.
I absolutely will. Thank you very much, Dan.
Moving forward in the pandemic. Coming up next, Captain Ron Meyers of the Chillicothe Police Department. Cut in total professional comfort. Husqvarna. Available now at Hometown Motors Incorporated, 818 Eastern Avenue, Chillicothe. And representing the Chillicothe Police Department, we have Captain Ron Meyers with us. And Captain Ron, we appreciate you checking in. We know that Keith Washburn, the police chief, could not be with us today, and we appreciate you standing in for him.
Well, thanks for having me.
We wanted to take a look at how the police department has had to change some of what it does just due to the fact that now you walk up and I saw some officers with face masks on the other day dealing with a subject out on the sidewalk, and now it's hand-to-hand contact in that respect, but you have to be as super careful as you can be.
Yeah, that's true. I mean, over the years we've always had to glove up, because the bodily borne pathogens and things like that. But now we're dealing with, something that's in the air, and you don't know who you're dealing with. So now you're going to see officers that are gloved up, masked up, and at certain times they may even have shields on if somebody's, spitting or something like that, or, actively spraying something.
And that, of course, is stuff that you didn't think about in the past. I mean, you just went and did the job out on the street, but it's a completely different thing. None of us were trained to start with this, say, 6 months ago, I would think.
Right. It's definitely been a learning curve, but in this environment, in our job, you always have to, try to think ahead and do everything one step ahead of what, current events are. So we've, everybody's been adjusting to it. But it's just getting, everybody to make sure that they're geared up at the beginning of the shift, and that, they're going to roll up on that hot call, and they're not going to have 2 seconds to, it could be something they're rolling up that they're witnessing, or it's an actual call, and they're going to have to prepare themselves before they get out of the car. They're not going to have the luxury of sitting back and getting their equipment on and get out and handle a violent situation. And we've been dealing with that, violent situations. They're not going to wait for us to mask up. So.
And we hope we don't have any more violent when things start to open up, because people are going to want to rush into the restaurant. They're going to want to go and do things and try to get things back to normal as best you possibly can. But how do you foresee us moving forward? How do you see us kind of governing ourselves in that respect so that the police don't have to be called in?
I mean, as far as like, mass openings of restaurants and barber shops and stuff like that, you're still going to have folks that want to do social distancing. You're still going to have folks that, either don't want to wear a mask or do want to wear a mask. You got to respect everybody's, rights to do these things, to either protect themselves or, move about freely. So, Bridge Street's going to be packed, and just ask that everybody, give it time and, just adjust to it as much as possible.
Be courteous and
Yeah,
be patient with one another, huh?
That's exactly right, because tempers are going to flare.
And that usually comes just with good weather,
Yeah, exactly. So we're going to get double whammied with, everything opening back up and warm weather. So,
yeah. How confident, what signs have you seen? Do you have levels of optimism at all, speaking for the police department, on how we are going to be able to move forward?
I'm optimistic. I think, management here at the police department is pretty optimistic that things are going to go smoothly. And we're all, excited for things to open back up and, get everyone back to normal. Because we see that. We're, on the front line. We see everybody. We're going to domestics. We're going to fights. And people are getting irritated. They're just tired of being cooped up. And it's nice to see people out and, get them back to normal.
Yeah. Get back to walking that dog, and maybe one day shaking hands again.
Right.
We'll wait, I guess, to see how that goes. We look back, and I guess the only thing we can do is look back on this. Who knows what the next 2 or 3 years we will have learned from this, and how life will be different. So let's hope that it'll be a better society that we live in today because of what we've gone through.
And we're always learning from, past experiences and, try to adjust into the future. So hopefully that's the way that this will turn out.
Again, our many thanks to our guests and their participation. Moving forward in the pandemic, a special report from Litter Media. I'm Dan Ramey. Thanks for watching. Until next time, stay calm and press on.